Lecture, my dear students, do you hear me?
Yes.
Today I think we have an important lecture because at first I want to revise with you uh, all information from our delivered lectures, okay?
Okay.
I'll ask you some questions from our delivered lectures and you can answer me. Ali, you and Maria, only two students are here, so who knows some answer about this question, you can answer, okay?
Okay.
It's no problem. If it will be difficult for you, I will explain it again and pay attention at these questions because after in the next week you will have some after one lecture, yeah, later you will have a midterm quiz, yeah.
Yeah.
So these questions are going to be in our exam.
Okay. Let's begin. Let's start. Okay. It's no problem now. First question.
1 second, doctor, please. To write the questions, can you write them?
I'm recording. I'm
Ah,
recording this questions. This lecture I'm recording now, and it's no problem. Yeah. Okay. Have you my presentations?
Sorry, what was that?
Presentations. Have you my presentations from our delivered lectures?
Yeah, they're on the drive.
Yeah. You have. Yeah. Okay. Mhm. Because some students write me like he wants some presentations from me, and I think I have recorded all lectures, and you have,
yeah.
yeah.
They
Yeah.
mean they wanted the PowerPoints. If you have PowerPoints, they meant our people.
What I don't understand what.
Students that asked about presentations, they meant the PowerPoints. If you have PowerPoints for
Yes,
our class,
PowerPoints, but when yeah, PowerPoints. You
we
must
have.
have because when we
Uh,
recorded this one, you have my presentation, yeah.
yes, I think so in our drive.
Mm-hmm. Okay. If it's problem for you, I'll share it again. No problem. Okay, let's start. Okay. Who can tell me who has published this definition? Health is a state of complete physical, mental, and social well-being and is not merely the absence of disease or infirmity. It's clear for you, or I can read it again.
No, that's clear.
Yeah, think about it. Don't be in a hurry and answer me, okay?
Okay.
Who established this definition? Health is a state of complete physical, mental, and social well-being and is not merely the absence of disease or infirmity. If you have no answer, you can tell me and I'll explain, okay? But
Yeah,
don't be in a hurry.
I can't really remember it from the top of my head.
Mhm. Ali, maybe you remember?
No, doctor, I don't.
No, okay, let's try. And remember, please, this definition established in 1948 by World Health Organization, WHO. It's clear now?
Yes.
Yes,
Okay.
clear.
Okay. Now, can you tell me the current criteria used to define a public health problem? Current criteria used to define a public health problem. You can check in the book, no problem, because I want to help you with these questions and maybe you can find this answer. It's more important for you, yeah? Current criteria used to define a public health problem.
Is it related to the 4 phases?
No, it's related to from the first is a condition or situation that is a widespread actual or potential cause of morbidity or mortality. And the second is a perception on the part of the public, the government, or public health authorities that the condition is a public health problem. It's a current criteria used to define a public health problem. So the first one, I repeat,
Yes, please.
a condition or situation that is a widespread actual or potential cause of morbidity or mortality. And second is a perception on the part of the public, the government, or public health authorities that the condition is a public health problem. Remember, please, okay?
Okay.
It's clear for you now?
Yeah.
Yeah.
Yeah. Okay. Don't worry about it that you don't have some answers at my questions, okay?
Be honest, doctor, I didn't yet study everything in dental public health because we have many other courses.
Yeah, I understand.
Yes,
That's why I'm trying to help you.
yes,
Okay?
thanks.
Okay. No, don't worry about it. Can you tell me about Webster's definition about health?
Sorry, who's the name?
Webster's definition about health. Mhm. Webster's definition about health. How defines the Webster health?
Lester's. Lester's.
Webster's definition. Webster. So Webster defines health. Listen to me attentively, please. Webster defines health as physical and mental well-being and freedom from disease. Do you understand?
Yes.
So he defines health as physical and mental well-being, freedom from disease. Okay. Now tell me, can you describe the core functions of public health? Core functions.
Is it the assessment, policy
Yes.
development, and the assurance?
Yes. It's an assessment, policy development, and assurance. You're right. Good girl. Okay. Do you remember which core functions constitutes?
I don't.
Which core functions constitutes? Maria, maybe you remember?
Do you mean like under assessment?
No, it's a monitor health. Yeah, assessment. Yeah, you're right. The second?
And then diagnose and investigate.
No, second is an evaluate. It's a monitor health. It's the same assessment. Remember, okay?
Okay.
The second is evaluate. It's assurance. And the third one is inform. And the same policy development. It's clear? Mm-hmm.
Yeah.
So monitor health, evaluate, and inform. It's clear?
Yeah.
Yeah. Okay. Now listen to me. How many phases contains history of public health?
Is it 4 phases?
Yes. Can you describe them?
So the first phase is elimination and control of the disease.
You're right.
The second phase is bacteriology and immunization.
You're right.
The third phase is the treatment of the disease.
Mm-hmm.
And the fourth phase is managing and preventing acute and chronic diseases.
Yeah, you're right, my dear. Okay, good girl. Now, who was the first dental hygienist? Maybe you remember. The first dental hygienist.
Alfred Kahn.
No, first dental hygienist, my dear. Ali, pay attention. First dental hygienist.
Do you mean when the first dental hygienist, what year they were discovered in, or do you want the name?
Name.
Okay. I can't remember the name.
Okay, it's an Aaron Newman. Remember, Aaron Newman was the first dental hygienist. Okay?
Yeah.
Yeah. Now, during the World War II, how many teeth were necessary in each arch to meet the military standard? During the World War II, how many teeth were necessary in each arch to meet the military standard for recruits? Okay, the recruits needed necessary 6 opposing teeth to meet the military standard. Remember, okay? In each, in each arch, they needed necessary 6 teeth. Okay?
Okay.
Now
Okay.
tell me 2 main global entities in public health. 2 main global entities in public health.
Is that the Pan American Health Organization
Yes,
and the World Health Organization?
you're right, my dear. It's the World Health Organization and Pan American Health Organization. You're right. And now, Ali, can you answer me and describe me abbreviation HWO? It's a very simple question for you. WHO.
Yes, World Health Organization.
World Health Organization. Yeah, you're
Yes.
right. And maybe you remember where are located headquarters of World Health Organization and Pan American Health Organization.
The World Health Organization is in Geneva, Switzerland,
Yes, in Geneva.
and the Pan American Health Organization is in Washington, D.C.
You're right. And how many countries it includes? Pan American Health Organization. Maybe you remember?
'51.
35, Ali. It includes all 35 countries. Ali, now I want to ask you, what is the dental public health? It is the main questions.
Its the main point is to prevent oral diseases and promotion of oral health.
Yes, yes. So it's a non-clinical specialty, yeah, of dentistry.
Non-clinical, yes.
Okay, repeat please. It's a non-clinical specialty of dentistry. that deals with the prevention of oral disease and promotion of oral health. You're right. Mhm. Now, who can tell me which is the most common problem in oral health disparities?
Sorry, could you repeat that question, please?
Yes. Which is the most common problem in oral health disparities?
For example, dental caries.
I didn't hear.
Dental caries, periodontal diseases, and periodontal diseases.
No, it's a common problem in oral health disparities. Oral health, yeah. It's a limited, most of English-speaking adults have limited literacy skills. Remember, okay?
Okay.
Many common problems. Okay, the most of English-speaking adults have limited literacy skills. Okay. Now, which oral health indicators were developed by National Oral Health Surveillance System?
May you please repeat, doctor?
Which oral health indicators were developed by NOHSS? It's a National Oral Health Surveillance System. Also, Association of State and Territorial Dental Directors and Centers for Disease Control and Prevention. Which oral health indicators were developed by them? Maria, you don't remember it?
I was just trying to process it. Would you be able to repeat it once again, please?
Yes. Which oral health indicators were developed by National Oral Health Surveillance System, Association of State and Territorial Dental Directors, and Centers for Disease Control and Prevention?
Is that linked to focusing on the community?
No. The first is dental visits. They developed dental visits, teeth cleaning, complete tooth loss, fluoridation status, dental caries experience, untreated dental caries, dental sealants, and cancer of the oral cavity and pharynx. Maybe you want to repeat this answer?
Yes, teeth,
Okay.
teeth loss.
Dental visits, teeth cleaning, complete tooth loss, fluoridation status, dental caries experience, untreated dental caries, dental sealants, and cancer of the oral cavity and pharynx. Now it's clear or not?
Yes, clear.
Yes.
Yes. Okay. How many cycles were funded by National Institute of Dental and Craniofacial Research? Please name them. How many cycles were funded by National Institute of Dental and Craniofacial Research? Name them. Okay, it's the first is an interdisciplinary research across components and community-based participatory research. Remember, interdisciplinary research across components and community-based participatory research. Have you some question?
Clear.
Okay. Now, please name the largest public health care financing programs. Name the largest public health care financing programs. It's a very simple question. The largest public health care financing programs.
Sorry, the
Largest public health care financing programs. Healthcare financing programs.
CVS and UNA.
Yeah, name. Which programs?
There is one called the CVS Health.
No, it's a Medicaid and Medicare. Remember, please, it's a Medicaid and Medicare. It's the two largest public health care financing programs. Remember, please, okay? It's a Medicaid and Medicare. It's clear for you?
Okay, yes.
Okay, it's a very simple question. You can read it in my presentations. So now, who is funding the Children's Health Insurance Program? Who is funding the Children's Health Insurance Program?
What that they help in funding children's health programs, insurance problems. What are they?
No, the Children's Health Insurance Program. Who funded Children's Health Insurance Program? Think about it and don't be in a hurry.
One second.
Eh, No problem. I'm waiting for you. We have 2 hours, so
Yeah,
we have many times. If maybe if you're tired, we can make some.
it's funded by the federal government and states.
Yes, it's funded by federal state program. You're right. Remember, okay? The Children's Health Insurance Program is funded by federal state program. Okay?
Okay.
Now we know that there are three basic types of managed care plans. And please name them. We know that there are three basic types of managed care plans. Please name them. Maria, you don't remember?
Health maintenance organizations,
Yes,
the PPO, preferred provider organizations,
yes,
and point of service,
twice.
right?
Yes, you're right.
HMO,
Well,
POS.
yeah, HMO, PPO, and POS. You're right. Okay. You can think about these questions, and it isn't difficult for you. Okay. What is involved in capitation? Ali, maybe you remember. What is involved in capitation?
It's a fixed amount of money that they
Mhm.
for it before patient period of time in advance to the physician. They pay
Yeah,
it before they do their physical care.
yeah. It's a managed care plans. Yeah, in capitation involved managed care plans. You are right. Typically paid as a fixed amount per enroll per month,
Yes,
regardless of whether that individual actually uses the services the plan offers. You are right. Mhm. Now, Maria, maybe you remember who is the gatekeeper?
Sorry, 1 second.
Don't worry, don't worry. Yeah, I'm waiting. Who is the gatekeeper?
he's the person in charge of the
Yeah,
of the.
it's a primary care provider,
Yes, he's the one in charge for the treatment of the patient.
which controls referral specialists.
Yes,
Remember, okay? It's primary care provider, which controls referral specialists. Okay. Now, what are the basis for these guidelines?
basis of which guidelines? Of his guidelines?
Yeah, guidelines. It's a risk assessment and anticipatory guidance. Remember, okay? The basis for the guidelines is a risk assessment and anticipatory guidance.
Okay.
Okay. Someone join us or not?
left us.
No one? Okay. Now, maybe you remember how many health communication strategies are used in public health?
How many house?
How many health communication strategies are used in public health? Named, please. Maria, you don't remember?
No, I'm just having a look at the PowerPoint.
I think as I remember, eight or not, 8 or 9.
No. Now listen to me now. How many health communication strategies are used in public health? It's a social marketing theory, and it's the second is the media advocacy. Okay? It's two.
Okay.
Social marketing theory and media advocacy. Okay? Now, how many criteria was established by Association of State and Territorial Dental Directors, ASTDD? Named, please.
By AS,
I don't hear.
by how many criteria were established by ASPP?
ASTDD, Association of State and Territorial Dental Directors. Think about it, and when you have no answer, ask me and I'll explain, okay?
I have
You have answer?
no answer. No.
No, okay, no problem. Now, how many criteria was established by Association of State and Territorial Dental Directors? They established 5 criteria, and now named. First is impact. Second is effectiveness and efficiency. Third is demonstrated sustainability. Fourth is a collaboration and integration. And the last is objectives rationally. Maybe you want to repeat? It's clear?
Yes.
Yes, it's in fact, effectiveness, efficiency, demonstrated sustainability, collaboration, integration, and objectives, rational. It's clear, yeah?
Yeah.
Yeah.
Okay. Now, which barriers are in oral health? Oh, remember, barriers in oral health.
Is one of them linked to having lack of basically English?
No, no, my dear. It's the structural, financial, and personal cultural barriers in oral health. Okay? It was the disparities, the literacy skills. When someone has the less literacy skills, it's disparities in oral health. Remember, okay? And now I'm asking you about the barriers in oral health. It's a structural, financial, and personal cultural. Clear?
Yeah.
Okay. Now, can you name the main oral health care workers? Who is the main oral health care workers?
So there's the dentist,
Yes,
the dental therapist,
yes.
the dental hygienist,
Mm-hmm.
the dental assistant,
Mm-hmm.
and the dental lab technicians and denturists.
You're right. Mm-hmm. Okay. What influences oral health care systems? What influences oral health care systems?
Does finance
Mm-hmm.
influence it?
Financing. Mm-hmm.
Technology.
Financing, population, age, location, oral health status, health policy, oral healthcare providers, educational systems. And the combination of all these influences oral healthcare systems. Remember, okay? The combination of all these influences and oral healthcare systems. Maybe you want to repeat it? It's a financing, population, age, location, oral health status, health policy, oral healthcare providers, and educational systems. Okay? Now, what is the main efficiency of oral health care delivery? What is the main efficiency of oral health care delivery?
Is that linked to the alternative models?
It's a lower cost to provide. It's a lower cost to provide dental care by the dentist. For example, by a dental nurse. Yeah, because as you know, to cure oral health, to make some teeth treatment or something, it costs very cost is very high. Yeah, and the lower cost to provide dental care by the dental nurses is the main efficiency of oral health care delivery. Clear?
Yeah.
It's like an alternative. You're right. Mhm. Now, which preventive efforts are known to us?
That includes the community water fluoridation, the fluoride supplements, fluoridated milk and salt, fluoride vanish, and
No, listen to me. Which preventive efforts? Efforts are known to us. The first is prevention, yeah? And health promotion to reduce oral disease rate. Prevention and health promotion to reduce oral disease rate. Do you understand?
yeah.
Yeah. Now, what are main functions of dentists in most countries? Main functions of dentists in most countries. It's a very simple question, I think.
Is it to prevent the oral?
Think main functions. What the dentists are doing. The first, to assess, yeah?
Yeah.
After?
And then after that, it's to treat.
No, after this, diagnose.
Yeah.
And then treat oral disease.
Yeah.
Okay? So, to assess, diagnose, and treat oral disease. What are main functions of dental therapists in general? In general, they assess, plan, and treat children in school. They assess, plan, and treat children in school.
Is that linked to the dental education?
Yeah, to assess some. I don't understand. What do you say?
So you know, like a dental therapist.
Yeah, dental therapists.
Yeah. So that do they educate the
Yeah, they
younger?
are assessing in the school. In school, yeah. Some children after this they are planning treatment for them, and after they treat them.
Okay.
Mhm. Now, the main functions of dental hygienists. What are main functions of dental hygienists?
Is it to educate?
At first, they are
The
assessing, my dear. At first, they are assess patient's oral health status. Remember, the first is assessment, yeah? They assess patient's oral health status as well as risk for disease. After this, thinking about it.
Sorry, are you asking what they do after the assessment?
Yeah, they assess patient's oral health status as well as risk for disease. After this, they develop a plan of care, then implement the plan and evaluate the results of treatment. It's a function of dental hygienists. Clear for you?
Yeah.
Okay. Now, tell me the main functions of dental assistants.
do they kind of prepare the documents that are required, or like the files that are required, like patient history and anything related to the patient that the dentist needs or dental therapist needs?
They at first provide support services for the patient and the dentist. They provide support services for the patient and the dentist. They clean up, set up the room, sterilize the instruments, greet and guide the patient to the cabinet. This is the main functions of dental assistants. Okay?
Yeah.
Now, the main functions of dental lab technicians and denturists. Do you know what is a denturist?
No, I can't remember.
The denturist is doing the artificial teeth. Dentures, you know? It's artificial teeth, yeah. Artificial teeth made by denturists. Now, what are main functions of dental lab technicians and denturists? Where they work? They work in dental clinics or in laboratories, or how do you think about it?
So you said that it's the denturists and...
Dental lab technicians and denturists.
So do they work in the labs?
Yeah, the technicians work in dental laboratories, in labs, yeah. And they don't provide direct patient care, yeah? But some technicians are considered to be denturists, and they work with patients to create and fit dentures. Okay?
Yeah.
But most of them they are working in dental labs. Okay. Maybe you want some rest? 5 minutes? Or
Yeah.
not?
Are we going to go through a PowerPoint today, or is it just the questions?
PowerPoint for questions? No, it's questions from my PowerPoint. So you can read it, it's no problem.
Okay, so are we going to go through any PowerPoint today?
Any PowerPoint today? I want to ask you to read the chapter 6, because today I want to revise with you these questions. And from the next week, please read the 6th chapter. It's a planning for community programs.
Okay.
Planning for community programs. And I will share for you this presentation, okay?
Okay.
And after this, I will ask you the questions from this chapter, okay?
Okay, I haven't really had much time to go over it yet, but I'll try to answer the questions.
I don't understand.
Okay,
Tell
so
me.
I haven't gone over this part yet properly, so I can't remember much of the stuff.
You don't remember these questions?
No, I'm a bit I get a bit stuck because I haven't revised it yet. But I just wanted to let you know because I might not be able to answer all of the questions.
You're not be able for questions? What you want to share these questions?
No, what I was saying was, you know, the chapter you said you're going to ask questions on now.
It's not today.
Not today. Okay.
Today I'm asking you to read the chapter 6. Yeah, it's a planning for community programs, and in the next week I will ask you these questions, my dear. Okay?
Okay, that's fine.
Not now. Now
Okay.
only the chapters 5. Include
Okay.
chapter 5 today. And in the next week, I will ask you some questions from chapter 6. Okay?
Okay. Okay.
Mhm. Maybe you want some rest, 5 minutes or 10 minutes?
Yeah, please.
Okay, no problem. After 10 minutes, I will return.
Okay, that's
And
fine.
I will ask you the questions from chapter 4. Okay.
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 Let's start again, my dear student. Ali, leave us. Maria, are you here?